Okay, so today we're going to talk about the external genitalia. We'll start with the penis. What is the penis? What is it? Erectile tissue. It's composed of erectile tissue. ايش يعني erectile tissue?
The blood flows into it.
What causes the erection?
Nitric oxide.
يعني simpler definition. It's a nitric oxide. Blood filling spaces. Okay, so the penis is actually composed of 3 erectile tissue. It has 2 parts. يعني مو 2 parts مقسوم قسمين بس إنه the fixed part of it is the root of the penis. It is fixed to this. What is that? The urogenital diaphragm, right? And the ischiopubic rami. And the movable part, the pendulous part, is the body. So it has a root and a body. What do we have in the root? We have the bulk of the penis, and we have right and left crura, singular crust. So this is the bulk, that is the crust, that is the crust. And then these 2 crura will continue side by side. And we're going to change the name. We're going to call them corpus cavernosum, right? Okay, and the bulb will continue as corpus spongiosum. So the 2 crura will be side to side, and ventrally applied to that is the corpus spongiosum. And you can see in the bulb and then through the corpus spongiosum, what do we have? We have, what do we have? Huh? What do you use it for? Urethra. Okay? That is the urethra in blue, and then it will lead to the external urethral meatus. Okay? So what is special about the root other than it being fixed? So you have the bulb and the crura attached to the urogenital diaphragm and the crura to the ischiopubic rami, to the bone. Other than that is that they are covered by muscles. So the bulb is covered by a muscle called bulbospongiosus, and each crust is covered by a muscle called ischiocavernosus. So only at the roots. Otherwise, the body has no muscular coverage. Okay? Now, bulb, corpus spongiosum, and then it will be the glands of the penis. The glands will be applied, will cap all the 3 erectile tissue, but it is an extension of the corpus spongiosum. Now, again, this is the body of the penis, is amuscular, I mean, does not have the bulbospongiosus or ischiocavernosus. You remember this from yesterday? The layers of the anterior abdominal wall, skin, underneath that is campers, underneath that is scapus, underneath that is the deep fascia, right? So what's going to happen to that? Skin will continue as skin, and then campers will stop at the level of symphysis pubis. You don't want that fat to go to the external genitalia. And then scapus will change its name, becomes colles, and in the scrotum dartos, and then it fuses with the perineal body and with the 2 layers of the urogenital diaphragm. What about the deep fascia? Deep fascia becomes bucks. Differences between bucks and colles is that bucks does not go to the scrotum. So it will be something like that. You will have the skin. Underneath the skin you will have
Dartus.
Colles. Underneath colles is buccal fascia. Now buccal fascia is gonna wrap all the three erectile tissue. Okay? And we'll send a separate septa to wrap individually the corpus spongiosum. So it is wrapping all the three structures, and also we'll send septa to wrap corpus spongiosum and the bulb on its own. But it changes its names. In different textbooks they call it bucks, or they call it gaulodates, or they call it the deep perineal fascia. In one of the slides I listed all the three names, so just in case you read different textbooks. Okay? So for the skin usually at birth will be covering the glans, right? We call that the prepuce. So when you do circumcision, that is the skin, extra skin that they will cut. Now skin will be linked to the glans also by this fold of skin. It's called the frenulum. Now, if we do a cross section of the penis, what are you going to see? You're going to see the skin. Underneath the skin is the colles. Underneath colles is bucks. So membrane on top of membrane. That's why if you move the skin over the penis, it can freely move, easily movable, because underneath is a membrane and then another membrane. Okay? So as you can see here, this is the corpus cavernosum, corpus cavernosum, corpus spongiosum, and each will have its own capsule, tunica albuginea, right? And on top of all of that, they are all wrapped by this white structure, which is buccal fascia. And also buccal fascia will send a separate septum to wrap the corpus spongiosum. Okay? So buccal fascia is going to wrap all these structures together. Now, in terms of blood supply, remember we have the internal iliac artery will give us internal pudendal blood vessels, right? Artery and vein. If you still remember from yesterday's lecture, you know they all come from Alcock's canal. Alcock's canal is on the lateral pelvic wall on the obturator internus, right? In the Alcock's canal you will have the internal pudendal artery and also the veins and the pudendal nerve, right? They will give branches to the rectum, inferior rectal vessels, but we'll not talk about that. I mean to the anal canal. So these blood vessels and the nerves will continue and will penetrate these fascia. They will be running between the fascia of the urogenital diaphragm. What did we call that? Deep perineal pouch. So one of the contents, or among the contents of the deep perineal pouch, are the branches of the internal iliac vessels and the internal pudendal vessels and the pudendal nerve. So if we remove the fascia, superior fascia, you can open the deep perineal pouch and you can see branches. Now let's take the arteries. Artery is going to divide. Each artery is going to give us branches to the bulb, to the crura, and one posterior. So the penis will receive 6 arteries. 3 from the right and 3 from the left. So the right one goes to the bulb, one goes to the crus, and one goes posterior. The one that goes to the crus, we call it the deep artery of the penis, the deep artery. And the one that goes posteriorly or dorsally, that is the dorsal artery of the penis. Yes?
When you say dorsal artery, you mean actually the dorsal deep, or it is just known as dorsal artery?
There is no dorsal deep. There is one dorsal artery. Okay? So from both sides, and you can see that the dorsal artery is actually running with the dorsal nerve coming from the perineum. So one to the bulb, one to the crus that is deep, and one dorsal. What about the veins? Veins, similarly, you know, from the bulb, from the crus, they're going to drain into the internal pudendal, to the internal iliac. But these are not the only veins. Now remember yesterday we said that is the urogenital diaphragm, and there is a defect here, there is a space, there is a gap just below the symphysis pubis, and we said that is for the passage of deep dorsal vein. So there is a deep dorsal vein also draining the penis, and this deep dorsal vein will go to prostate, and in females will go to vesicle or the bladder venous plexus. So why did we say deep dorsal vein? Because we will have a superficial one. Okay? So if we do a cross section like this, you know, we will find arteries to the bulb, and then the deep arteries to the crura, and then these are the dorsal arteries, and this is the deep dorsal vein. This is the deep dorsal vein, and we have the dorsal nerve as well. Now the one thing in common for all of them is that all will be wrapped by
Buck's fascia.
Buck's fascia. The only blood vessels that are not wrapped by Buck's fascia is this one. This is the deep dorsal vein, so this will be the superficial dorsal vein. Why we say dorsal? Because we have also the lateral superficial veins. So these superficial veins will eventually drain into the saphenous, which goes to the femoral. Right? The deep dorsal vein goes to the prostate. Okay? So Buck's fascia will wrap all the erectile tissue with their blood supply, with no exception. With one exception, is that of the superficial veins. The superficial dorsal and the lateral superficial veins. Clear? So the penis is supplied by 6 arteries, 3 from the right, 3 from the left, and is drained by the same veins, plus the deep dorsal vein and the superficial dorsal veins. Okay? Is this clear? Fine. That is the text طبعا in the previous slide. Now when it comes to the lymphatic drainage, you know, skin of the penis will go to the superficial inguinal lymph nodes, while, you know, deeper structures will drain into, they will follow the arteries, they will go to the internal pudendal, internal iliac, okay? Iliac lymph nodes. Nerve supply of the penis is going to have what? Somatic and autonomic, right? Somatic for simple sensation from the skin and from the glands of the penis. That is the function of somatic. Pudendal nerve. Now in terms of functionality, you will have sympathetic and parasympathetic. Now remember this, sympathetic is for
ejaculation.
sympathetic is for ejaculation, some ejaculation. Parasympathetic, you know, barra, huh? Parasympathetic is for erection. That's a new mnemonic, huh? So sympathetic will come from the spinal segments T12 to L2. Parasympathetic is usually where? S2, 3, 4. Okay? So what did we say? We say pudendal with its branch, the dorsal nerve of the penis or the clitoris for female. That is for somatic sensation, goes to the glands, goes to the skin, goes to the perineal muscles so that, you know, they contract. But in terms of functionality, it is sympathetic and parasympathetic. Sympathetic will come, and its function is to ejaculation. Parasympathetic is for erection. What about, that brings me to the uterus. Do you know anything of the uterus? What's the nerve supply of the uterus? So what matters to us is the pain, right? Pain from the uterus, right? What type of pain is it? Ischemic pain. How does it reach the spinal cord?
Afferent fibers.
Afferent fibers, okay. Bas? From the intraperitoneal structures, yani the fundus and the body, they will go with the sympathetic. From the infraperitoneal, they go with the parasympathetic. The last 2 centimeters, pudendal somatic. And how do we anesthetize that? Spinal or epidural. Fine. So, that is the nerve supply of the penis. Now, penis is supported by 2 ligaments. One will come from the linea alba. Do you know what linea alba is? Alhamdulillah. And it will support the uterus, will be attached to the lateral sides of the body of the uterus here. And there is one...
Venus. Uterus.
Similarity, eh? And this one is called the suspensory ligament, which basically attaches the penis, the dorsal side, to the symphysis pubis and the fascia covering the symphysis pubis. For the females, the clitoris will have only the suspensory, it does not have the fundiform ligament. Now, females, basically the same structure. Are we going to have a bulb? Yes, but what is the difference? The difference is that because of the presence of the vagina, the bulb, vestibular bulbs, we call them, or bulb is divided into 2, right? Do we have crura? Yes, right and left crust. So the 2 crura, they come together, and a little bit from the bulbs underneath, all will be capped by clitoris, glands. So what you see actually with your eyes is not the clitoris. And people, they use that, oh, this is not the clitoris. All of the clitoris is hidden by the skin and the labium majus. You cannot see it. The only thing that you can see from the clitoris is the glands, this part here. Now the bulb is covered by bulbospongiosus, the crura, they are covered by ischio cavernosa, similar to the penis as well. In terms of blood supply, nerve supply, they are all the same. Okay? Now, this whole view is called the vulva, the external female genitalia. This area is called the vulva. What do we have in the vulva? We have the mons pubis, which is basically this area of skin, hairy skin. Underneath we have a pad of fat. And then we have labium majus, right and left. Again, it's a fold of skin filled with fat, right? What is attached to the labium majus? Which part of the gubernaculum? The round ligament of the uterus. And then this is the labium minora. It is a fold of skin, no fat, no hair. Now, labia minora will come. This is what you see from the clitoris. Only the glands. The rest is hidden underneath the labium majora. Now, this skin will, below the glands, will meet and will form the frenulum, similar to the penis. Above the glands will form the prepuce, okay? Similar to the penis. Where they meet here, it's called the fourchette or the frenulum of the vagina. Now, this area between the 2 lips of labia minora is called the vestibule. This area is called the vestibule. What do you see in the vestibule? What is this? Vaginal opening. It is covered by membrane, hymen, completely, right?
No, incomplete.
There. So that is? Can be is? Why? For menstrual cycle, right? For menstrual blood release, right? So what is this? Urethral opening. Now underneath the urethral opening we have two tiny openings here. Two openings here underneath the urethra. They are opening for paraurethral glands. We call them Skinny's gland. On the anterior wall of the vagina, close to the lower end of the urethra, we have glands that will secrete mucus. We call them Skinny's gland, and they open just below the urethra. Also here we have two openings. What are these openings at 5 and 7 o'clock? What are they? These are the openings of greater vestibular glands or Bartholin glands. And they are homologous to what in male? Or Cowper's gland. Now in terms of location, what is the difference between the Cowper's and Bartholin gland? In males, Cowper's gland or the bulbourethral gland are within the contents of the deep perineal pouch. In females, they are located where? Here. Just underneath the bulb of the clitoris, right? So outside the deep perineal pouch, below the perineal membrane, just underneath the clitoris, or the bulb of the clitoris. Clear? Fine. Now yesterday we said we have the deep perineal pouch, membrane, and in between two muscles, right? Yes. Contents, what are the contents? The two muscles? The sphincter and the deep transverse perineal muscles. Plus, in male we have the Cowper's gland and the blood vessels and the nerves, right? They go, in order to reach the external genitalia, they have to go through the deep pouch first. Okay? And we said that this is the urogenital diaphragm here. Between the urogenital diaphragm and the skin and the Colles fascia underneath, we have the superficial perineal pouch. Basically everything below the urogenital diaphragm. It is a closed face posteriorly. Why? Because it fuses with the urogenital diaphragm. But anteriorly, there is a potential space between buccs and Colles, or between superficial and deep. That's why sometimes if you have injury to the urethra, urine might go up the anterior abdominal wall. Now, what do we think you will have in the, what are the contents of the superficial perineal pouch? And this is the last segment of the lecture. What are the contents of the external genitalia? So in males, you know, you're going to have the bulb and the roots, the bulb, the crura of the penis and the clitoris, right? In the deep, what did we say the name of the muscle? The deep transverse perineal muscle. Why deep? Because we have a superficial one. So one of the contents is the superficial perineal transverse perineal muscle or muscles, and this is the perineal body. What else do you think among the contents of the superficial pouch? Vessels, right? These structures, right, they will receive arteries and nerve and will give up veins, right? So blood vessels that will supply the root of the penis and the clitoris also are there. So the only common thing between the deep and the superficial pouch is, or are,
the transverse muscle.
The only common thing between the deep and the superficial are the blood vessels. We have just said it. You know, you have the blood vessels. You have the blood vessels coming from Alcock's canal, penetrating the deep pouch, and then from the deep they want to reach to the external genitalia. So the only common thing between the superficial and the deep are the blood vessels and the nerves, because they penetrate the deep first and then they reach the superficial. The only other difference is that Cowper's gland in males is in the deep, Bartholin gland in females is superficial. Okay? Now for females it's exactly the same with the exception of Cowper's gland. Now we call them the greater vestibular gland or Bartholin glands. They are located underneath the bulb of the vestibule or vestibular bulb or the bulb of the clitoris. Okay? So these are the greater vestibular glands underneath the bulb of the clitoris, and this is the only difference. Okay? Any questions?